You also touched on one important point, which is something that Debarati mentioned in her talk before, where you really want to help people specialize in a topic. But if you're going to work across sectors, you also have to learn a lot of other skill sets. So I wonder if the other panelists have any insights on this, on what have they noticed as a good example of specializing, but also being the jack of all trades in a way.
Can you be a bit more specific?
Yes, sure.
What do you mean exactly?
So the idea is that very often you have to specialize as a doctor, let's say, but then when you're working on a different topic that maybe has a bit of sanitation involved, has a bit of geographical elements involved, you need to know some amount of that. And how do you do this without dumbing down the other fields to help you as a newbie understand it? I think Debarati has a...
Yes, I think it's an important consideration, especially for the people in this room. I used to give lectures to, at that time, before they changed the system, to 4th and 5th year medical students. Okay, so towards the end of their 6-year program, at that time it was a 6-year program, and so it was 5th year, or 5th year medical. And we also had a program for which my course was obligatory for the medical students to be able to do a internship overseas. Right? So the internship overseas, they had to go through my course, pass the course, and then they could compete to go overseas for the internship. And I would give my lecture as you may have noticed, I'm very enthusiastic about my field. I like enormously what I do, and I do it with a lot of enthusiasm, and that can be a bit of an infectious thing. So I was there in front of the class, for the, whatever, how many hours, 30 hours that I taught, I would go on with lots of enthusiasm. At the end of that, very often, not one year, maybe, several years, I would have students come up to me. It still happens now. Students come up to me at the end of the class saying, we would like, the last one was quite interesting because there were 3 women of Arabic Maghrebian origin. So there were people who came from a background which is not quite the Belgian of my friend here, Elise, but something else. But they were very keen. It was quite interesting. And they said, we're going to finish our medical school, medical studies next year. And we would like to go abroad. We would like to do something, like you said, all these humanitarian, all this kindness and all these nice things that people do. And, it was quite touching that they wanted to do it. And this comes to the point that you're making about having a specialization. And I remember asking them a little more kindly than what I'm saying now, is that what is it that you have to bring? You want to go abroad. This is not tourism. This is not tourism. What do you have to bring to the table? What do you have to offer? Not only offer the organization that's sending you, because the organization that's sending you is going to require or should require something that you're bringing, some skill, but the people that you're going to serve. What are you going to bring to them? And if you don't have anything to bring to them, then you must not go. Because you're more of a burden to the population than you are bringing something. So the net benefit is negative. The net benefit is negative. And that brings to my point is that develop skills or a specialism that gives you a competence in something that you have in your hand. There are so many things that you can do, whether it's, from political science to logistics to medicine to physiotherapy, masses of stuff. But get a skill. This is what I said. I told them, get a skill that you can go to the people, you can go to your job and say, I have this to offer. I can do this. And this is what I'm bringing to the table. And that is why I think transdisciplinarity should not translate into no disciplinarity. You know, that must not be the case. You have to have your own skills, and then you bring it to the table and you have all the other people who have skills, and that will bring a much stronger cohesion to the end product.
Thank you. And yes, please.
Now that I understand the question. No, I would like to react to what Professor De Barati said, but also start with saying, I agree, of course, I completely agree that you need to know something well, otherwise you have no added value. But at the same time, you cannot know everything. So I think, Professor, you would agree that if you take Saint-Luc back off the boat, there will be a social worker at the bedside of an orthopedic patient. So it's not because of the orthopedic surgery, it's because the system doesn't work or is organized otherwise, didn't take into account all these different aspects of what someone needs, the whole from the beginning till the end. To make my point, you cannot, one person needs to have his skills, cannot know everything, but you should know what exists and who you can who you can call upon to help, to be complementary, to make the whole system work and not just your piece of the system. And I think that's more of an issue and of a thing. If we look into collaboration and to look how different sectors should work together, and of course I'm looking from the health perspective, I'm looking from how you should make sure that everybody has access to basic health services. And I agree there are many other aspects, but let's not forget that. And let's not forget that it's so complex, that there is so much more to it than doing this orthopedic surgery, because if that's the only thing you do, then you maybe better let him die in the first place, because otherwise he will be lost anyway. So I agree that there is or in my experience, as I said, with the mapping, with the map making, it is completely possible to know other things and to get to know how to do it a little bit, as long as you acknowledge that you need also other people and that you get that expertise on board to make the whole system work. And just one more thing, I also agree with your students that maybe they have had a different vision, and they thought just by going abroad they can make a difference, that they need to have an added value. But at the same time, I think that is really missing now, the opportunity to get to know other systems. And you don't need to go there to show other people how to do it. You can go there without much knowledge, just with your diploma, because you want to get to know other systems. And it's not about white people getting to know the African systems. It's about everybody getting to know different systems, because systems are so different. Health systems are very different. It's not because some are functioning well and others are functioning less well. The whole thing is different because they take place in a different context, because the governance system is different, because all the other sectors are different. So it's really, I think, some people shoot me for saying that, but it's really a pity that we don't get this opportunity anymore as young professionals to go abroad and get to learn how other systems work. And we are catapulted after 6 months or sometimes after a mission of 2 weeks onto a desk to work in administration, WHO, United Nations, and we do capacity building, and we go and tell people how to do it, but we don't know how it works. Doctors, I was just saying to Professor De Barati, I had the time I started working 20 years ago, so I had just the occasion to work for a couple of years as a medical doctor in different health systems before I was asked, and also to go more into organizational work, to do more management functions And I'm so grateful that I had this occasion, but I still think it was not really enough. I should have done a little bit longer first. The work, the hands-on work, what I was taught to do, and then you can talk about. Then you have a legitimate place at the table afterwards. So, well, that's my plädoyer.
Thanks, Kashi. And sorry, thanks, Elise. And I know Kurt also has some.
Again, I want maybe to tackle it from a slightly different perspective. As a Navy officer, I had the opportunity to travel to a lot of places and to see many different things. But we are still a little bit trapped in this opposition between the specialist and the generalist and the jack of all trades, you know, and of course we have a tendency to try to be the best in our field and to bring the best added value, and simply in some cases that's not possible. I would say the speciality of a military is that he has no specialization. He must be a jack of all trade. He must, when he deploys, he must be a cook. He must be a doctor, he must be a fighter, he must be a road builder, a bridge builder, a house builder, because very often there's no other choice than to be there. I will take an example. You all remember for the 6 past years after the terrorist attacks, you have seen military people in Brussels, and they were deployed together with the police. There have probably been more, but I remember clearly 3 cases while I was on duty where there was a violent incident which was not directly related to terrorism, but where there was a critically injured person there. Well, that military, who was an infantry soldier, he was not a paramedic, he was not a doctor, but because of his expertise and his training, he was able to give the first aid, and in one case CPR, that in this case saved at least 3 lives. Okay? Now, it's quite different when you deploy, because one specificity about our jobs is that when we make mistakes, people die. You have no option. You are very often in a critical situation where when you make a mistake, people die. So we have this kind of sick habit of wanting to control everything because we have to rely on ourselves. But then we are confronted to specialists. And I often tell my young officers, I say, you have to learn the skill of humility. Your specialty is to be polyvalent, but you are not more specialized than an engineer or an architect just because you can build a tent. You are not more specialized than a doctor or a paramedic because you know how to do CPR. Then comes the moment where you have to give over. You have been in the field, you have been a first responder, you came as a first entry force, you've been doing everything, and little by little, other more specialized people come in, and you have to give over to them. Well, it's a little bit like you raised a baby because they wouldn't even be able to be there in the first place if you were not. But you have to recognize that you are no longer the specialist, and now it's for them to take over, and they will do a better job. So from polyvalence, we transit into multi or transdisciplinarity. And that is a learning process. And so for me, the 3 words that we need to remember here is learn the skills of humility.
Mm-hmm.
Indeed.
And maybe just to add very briefly to that, I'm a specialist on supply chain. And for me, even leading a team with different people, different sectors in a team, I think is very possible. It's just about being able to asking questions. And that really comes back to the humility as well, and knowing what you don't know and what you do know, and really respect coming into there. I mean, there's a lot of words that have been said today, but I think it's not necessarily contrasted in that way.
Mm-hmm.
Yeah.
Thank you. These were really interesting insights. And I really liked how it came down in the end to the interpersonal communication and people actually being able to respect and work together. That's really interesting. Kashi, I have a question for you, which I actually sneaked into the discussion because I'm personally very interested to hear your opinion. So, right now, with the COVID situation, there is a lot of talk, of course, about access to vaccines, access to medicines in general. And I've been seeing this a lot as a sort of a division between two sectors. One is the economic sector, where the emphasis is on incentivizing R&D, and this is why we need to price up vaccines. And on the other hand, of course, you have the health sector with the very basic idea that everyone should have access to health. How do you see these two different sectors working together in the future, or not?
Well, starting with the funding that goes to R&D from the companies. I mean, obviously, as we all know, most of the funding for research and development of the vaccines was public funding. Yeah, and the profit goes to the pharmaceutical big pharmas mostly. And there are a lot of talks on TRIPS, like waivers and, IP and the whole technology transfer, local manufacturing capacity, like ramping up local manufacturing capacity in Africa, amongst other places. But I mean, mostly Africa right now, for instance, through the big EU initiative. However, as we all know, the reality is that it's like 3-4% in Africa right now is vaccinated. And at the same time, we're pushing for the third dose here and vaccines are expiring on the shelves. So in my view, and I notice I get a bit emotional about it even, it's a very painful example of not working together of two sectors. And you ask for a future. I mean, it's really, there's so much greed, and people are so much just thinking of me, and the whole thing of the whole notion of global solidarity is very far away there. And I think the COVID pandemic is very much shown this in, well, as I said, a very painful way. So I'm not being really optimistic here, but I feel very passionate about this topic.
I understand. No, but thank you for the reflections. It's something that, of course, all of us are very passionate about in the health sector. And yes, not a very optimistic view, but it is the reality. Debarati, I know that you have a lot of work in policy and academia as well. I wonder if you could enlighten us on the growing health in all policies movement, where different policy sectors work towards health as an end goal. So particularly after hearing Kashi's views that the economic sector doesn't really have health as a priority, could you tell us how well you feel that transdisciplinary policies are going currently?
You mean in the world?
In the world?
Sort of.
Or even if your expertise is Belgium, it would be nice to know Belgium. But globally is also very interesting.
Yeah, I think that's something, just a little comment about global health is that I would like to make before I talk about the policies on trans, is that global, it's important to remember, global health is not a concept that covers stuff that's going on over there. It also, global health, the Western European countries, the North America, is also part of the global health. And what Olivier said right at the beginning, I think it's a very important thing to remember for people in this room. When I was a student still in the US and I was then married to a Belgian, not then, even now, married to a Belgian. I remember at one point, we traveled, he married an Indian woman. And so, third world countries, developing countries, important and things like that. And then we came here to Belgium. And he was working much more with policy and the parliament and the governance over here and you know, stuff in Belgium. And I remember getting a bit upset at some point, gently upset, that he's not really taking interest in my country. And, you know, in India, and, you know, we are all poor countries and you're doing nothing for it and you're just absorbed with what is happening in Europe and things. And he said something which I think echoes what Olivier said, is that he said, you know, at the end of the day, if there is equity and fairness over here, there's going to be equity and fairness on the other side of the globe. So you cannot bring equity and fairness and justice to the other side of the world if you don't make sure that it's also happening here. So I just wanted to make that little point to say that any of you, if you decide to work on issues related to, quote unquote, the first world, it is equally important than if you go to say, go to work with the poorer parts of the thing, of the world. Having said that, I'll just make a short comment on transdisciplinary policies. I think there is a cleavage, complete cleavage between policies that take into account transdisciplinary concerns by, for instance, in the sector, which are non-profit, which are voluntary, and which are United Nations. So all of this sector, they are all very trans, you know, there's very trans. They want to do multidisciplinary, transdisciplinary, and get all of that. They're in there, 100%. But they probably represent a very tiny proportion of the health activities and health policies of the world. Most of it is in the private sector. That is the reality. And I don't know, I'm sure maybe there are people around here or even in the room who understand better how the private sector, the pharmaceutical sector, for example, you know, GlaxoSmithKline and all, how that part of the share of the cake, what kind of transdisciplinary interest, concern they manifest. We only talk to our own people, you know, the UNICEF guys and the Médecins Sans Frontières and the MEMISA and all of these guys, you know, this is great. But they represent a very small share. And the other part, I'm afraid, I don't know. And I'm not so clear that transdisciplinary interests are actually that high up on their policies. Yeah.
Wow, indeed. Thank you, Debarati. And I heard from my colleague that we're running out of time, which goes to show when you have a fun discussion, you can really lose track of time. And I want to make time for our audience to also ask questions. So I have a few questions here that I will address to the panel. So there is a question, what would you suggest as a practical strategy to address power imbalances between disciplines in global health? If anyone wants to take it, you can raise your hand.
I think power imbalances are mainly a result of ignorance. There are some disciplines and some policies that for some reasons are more appealing or are, I will use the very politically incorrect word of they are sexier, you know, it's they look nicer, and therefore there will be a bigger part of the attention going to them. And then you have some disciplines who are less flashy, but they are as necessary. And we will always tend, for instance, to praise the one where the specialist is the easiest one to recognize. I'm sure that a lot of people in this room can tell me who is the athlete that ran the fastest 100 meter. If I ask you, which is the woman who has the best result in 7 camp or in decathlon or men in decathlon, that person is able to do 80% in all the disciplines. Nobody is going to remember him because he's not the specialist in anything, because it's not spectacular. So we should, and I think there is a responsibility for those who are in these key disciplines that are in the middle of the attention, to draw the attention on enablers that are important in such a way that there would be a better balance. So there is a responsibility for these people who have the attention to give some of that attention, and attention means funding, other disciplines as well.
Thank you. Yes, another question then from actually from Olivia. Most of the discussions so far have been about response and addressing dire situations like in an emergency. How about transdisciplinary approaches in prevention and in risk reduction?
Well, for me, prevention is completely part of healthcare, so I didn't exclude it. I think it's a very important part for health prevention and health promotion. And I'm back to education, not to the basic education of healthcare workers, but to education in general. The lack of education, I think, is one of the biggest disciplines or sectors that cause health problems, because knowledge is not only power, but knowledge is also health in a way. There's so much that is not linked to medicine. If you talk about prevention, that is important to know. What was the question?
Basically about transdisciplinary approaches.
Transdisciplinary, yes. So, well, it's a bit of an answer because I think if we talk about prevention, there's so many sectors that come in. We have prevention at work, we have traffic, there's everything, clean water, hygiene, education, as I said. I mean, it's the perfect example to say where all sectors play a very important role if we look about health prevention.
And maybe just to add to that as well, in terms of health prevention, the funding going to health prevention, again, because it's less sexy, is usually less than treatment. Yeah. And that's also why competition for this funding might be even bigger. And I think a lot of the actions obviously follow the money and follow also the focus where the donors is. We kind of respond to what donors ask. Donors ask multidisciplinary, transdisciplinary approaches right now, so we deliver.
There's another question. In your opinion, what soft skills are especially relevant for someone who wants to work well in a transdisciplinary environment?
Humility.
Respect.
Respect and truth.
Indeed, respect and humility.
And listen to the other.
Yeah.
I think that underscored the discussion today as well. Indeed. There is also a comment which is in French, and I'm not going to attempt to say it in French because my accent is horrible, but roughly translated, I think it is speaking of transdisciplinarity. The truth is different actors don't work well in a collaboration. The person who said it in French, I hope I did justice with my translation. But this was indeed a comment, and I think it echoed some of the experiences that our panelists mentioned.
The question is about legitimacy. It is how legitimate are people in a transdisciplinary approach, and it all comes back to what we already touched. There must be a recognition of the added value that someone brings to the group, and if the person who is in the position where he cannot legitimize himself sufficiently because he's not in the center of the attention, then it is the role of those who are in the center of the attention to point to the legitimacy of the others and to point out that his job is not of lesser importance just because it is not spectacular.
Thank you, Kurt.
In the military, we have it all the time. When I'm on board of a ship and I'm And I'm the one that people can see because I'm navigating the ship and everybody says, wow. And the guy who is dealing with the engine room, nobody sees, he's in dirty clothes, he has no flashy uniform on, but I can tell you, I cannot do my job if that guy is not doing a good job in the engine room. And I think in transdisciplinarity, it's all about this. It is the enablers are as important as the people who are in the flashlight.
Thank you, Kurt. Thank you for translating accurately and your wonderful response. Thank you to all of our panelists for a really brilliant discussion. And it was really nice. And we're very fortunate to have such an amazing, diverse group of experts to share their experiences with us. Something that really stood out from this discussion for me is that transdisciplinarity is already a part of most of our work. You know, whether you're an academic trying to reach out to policymakers and get them to scale up your research output, or even if you're global health students who are trying their hand as event organizers. So we all have to try to get out of our professional role and really try other sectors. And that's the only way you can really make your work reach out to other people. You can make your work more impactful and also broaden its scope. And as someone who is also very interested in this field, the intuitive thought which really attracts you is, of course, there's strength in numbers. And if you share a problem, you halve the problem. But it's really important. I read this quote once that there is strength in numbers, but organizing those numbers is one of the biggest challenges. So it's really important when you work in this field to do it the right way. So I really hope that the discussion today helped all of you as well. And yes, applaud now.